Dementia is a collective term for a range of cognitive impairments that go beyond the expected changes in mental function associated with aging. The most common form of dementias is Alzheimer's disease, though there are many other types, including vascular dementia, frontotemporal dementia, and Lewy body dementia. All these conditions lead to the gradual breakdown of cognitive abilities, including memory, reasoning, and decision-making skills. While many people experience occasional lapses in memory or have difficulty recalling names or words as they age, dementia presents a more serious and persistent issue. It often affects not only memory, but also a person's ability to communicate, perform daily tasks, and make sound judgments. Early detection of dementia is crucial because it allows for early interventions, which can significantly improve the management of the disease. In this video, we will explore the key early signs of dementia, highlighting the distinct indicators that should never be ignored. Being aware of these symptoms can help ensure timely diagnosis and intervention, which can make a significant difference in the lives of those affected by dementia. Before we continue, if you're enjoying this video, please take a moment to like, comment, and share it with your friends. It helps more people discover the content. Now, let's dive into the 7 early signs of dementia you should never ignore. Memory loss is perhaps the most commonly recognized symptom of dementia, and it's often one of the first signs to raise concerns. However, not all memory loss is indicative of dementia. It's normal for people to occasionally forget things, like where they left their glasses or the name of an acquaintance. These occasional lapses are typically harmless and don't affect daily life. In contrast, memory loss related to dementia tends to be more persistent and disruptive. One of the earliest signs of dementia is difficulty remembering recent events. A person with early dementia may forget what they had for lunch or struggle to recall conversations that took place earlier in the day. This kind of forgetfulness isn't simply a matter of occasional absent-mindedness, but rather a consistent pattern of difficulty retaining new information. Additionally, individuals may start repeating themselves. This might include asking the same questions over and over, even after receiving answers. For instance, a person may ask about a family member's whereabouts repeatedly, forgetting that they have already been informed. This repetitive questioning can be frustrating for caregivers and loved ones, but is a clear indication that memory is being affected beyond what is typical with aging. Another concerning sign is forgetting important dates or appointments. A person may fail to remember birthdays, anniversaries, or regular medical appointments, or they may become confused about the time of day or the day of the week. This can lead to missed events or a failure to recognize significant life events, further impacting the individual's ability to maintain their routine. Another early sign of dementia that should never be ignored is disorientation. People with dementia may begin to lose their sense of direction, even in familiar places. This could mean getting lost in their own neighborhood, forgetting the way home, or becoming confused about where they are in their own home. This type of disorientation goes beyond occasional forgetfulness or a brief moment of confusion. It represents a deeper disruption in cognitive function. A person with dementia may also have difficulty keeping track of time. They might become confused about the date, the time of day, or even the season. For instance, they may believe it is morning when it is actually evening, or they might be confused about what year it is. This confusion about time can lead to a distorted sense of reality and difficulty maintaining daily routines. Disorientation can also affect a person's ability to recognize familiar people or places. They may forget the names of close family members, such as their spouse or children, or fail to recognize their own reflection in the mirror. This can be deeply unsettling for both the person with dementia and their loved ones, as it marks a significant decline in their ability to navigate the world around them. Moreover, individuals with dementia may struggle to follow directions, even simple ones. They may forget how to use everyday items, such as a phone or a television remote, or be unable to follow a recipe or instructions for completing basic tasks. This difficulty with direction following can make it challenging for individuals to perform daily activities independently. Difficulty with language is another key early sign of dementia. Individuals may begin to struggle with finding the right words during conversations. They might pause frequently or use vague terms such as that thing or you know, when they cannot recall the specific word they are searching for. This can lead to frustration as they attempt to express themselves but cannot fully communicate their thoughts. A person with dementia may also repeat themselves frequently. They might tell the same story or ask the same question over and over without realizing they've already shared that information. This repetition is different from the occasional retelling of a favorite story. It's a pattern that reflects memory loss and difficulty processing new information. Additionally, people with dementia may find it difficult to follow or engage in conversations. They may struggle to keep track of what others are saying or have trouble understanding complex sentences. This can lead to them becoming disengaged from social interactions or avoiding conversations altogether. In more severe cases, individuals may no longer be able to speak coherently or may lose the ability to communicate altogether. Written communication can also be affected by dementia. A person might have trouble reading and understanding books, newspapers, or even simple instructions. Their ability to write legibly or make sense of written words may also deteriorate. This can interfere with everyday tasks such as paying bills, writing notes, or following written instructions, leading to frustration and a sense of isolation. As dementia progresses, it can also affect a person's physical abilities, particularly motor skills and coordination. In the early stages, individuals may experience subtle signs such as difficulty balancing or walking. They may stumble more often, trip over objects, or have trouble getting up from a sitting position. These signs are particularly concerning as they can lead to falls and injuries, making it harder for the person to maintain independence. Fine motor skills are often among the first abilities to decline. Tasks that require delicate hand-eye coordination, such as writing, tying shoelaces, or buttoning a shirt, may become increasingly difficult. A person with dementia might struggle to complete familiar tasks they once performed with ease, and their handwriting may become shaky or illegible. This decline in fine motor skills can also impact daily activities such as cooking, grooming, and managing household chores. In more severe stages of dementia, people may have trouble using utensils while eating, or may find it difficult to dress themselves. They might no longer be able to safely use kitchen appliances, which increases the risk of burns or other accidents. Similarly, they might struggle with other tasks requiring coordination, such as driving, navigating stairs, or managing their personal finances. Changes in motor coordination can also lead to noticeable shifts in posture and mobility. The person may become more stiff or rigid, walking with a shuffle or hunched posture. The decline in motor skills not only affects the person's ability to live independently, but also poses an increased risk of accidents and falls, which can worsen the individual's overall health and well-being. As dementia progresses, it can cause significant changes in a person's personality and mood. One of the most noticeable early signs is an increased sense of anxiety or depression. Individuals with dementia may become unusually fearful or paranoid, often over things that would not have bothered them previously. They might experience extreme mood swings, shifting from moments of happiness to deep sadness or frustration with little apparent cause. Irritability is also a common symptom of early dementia. Individuals may become easily upset or angry, even in situations where they would typically remain calm. These mood swings can lead to difficulties in relationships, both with family members and friends, as loved ones struggle to understand the changes in behavior. In some cases, people with dementia may become withdrawn or lose interest in social activities that they once enjoyed. Hobbies, interests, and passions may no longer hold the same appeal. A person who once loved gardening may stop tending to their plants, or someone who enjoyed attending social gatherings may begin to avoid them altogether. This withdrawal can contribute to feelings of isolation and loneliness, which can further exacerbate the symptoms of dementia. Loss of interest in personal care is another sign of dementia-related mood changes. Individuals may neglect grooming habits, such as bathing, brushing their teeth, or changing clothes regularly. This lack of self-care may be a result of confusion, forgetfulness, or a loss of motivation. The person may no longer care about maintaining a well-groomed appearance or adhering to basic hygiene routines, which is not typical of their previous behavior. This neglect can be distressing for family members who may notice the change and struggle to understand why their loved one no longer seems to care for themselves in the same way. In addition to cognitive and motor changes, dementia can also lead to alterations in sensory perception. People with dementia may experience changes in how they perceive the world around them, particularly in terms of their vision, hearing, taste, and smell. These changes can create confusion and discomfort, as they may no longer perceive things accurately. One of the most common sensory issues in dementia is changes in vision. People with dementia may experience difficulty with depth perception, which can make it challenging to judge distances or navigate around objects. This can increase the risk of falls and accidents. In some cases, individuals may experience visual hallucinations, seeing things that aren't there, such as people, animals, or objects. These hallucinations can be frightening for the person and those around them, as they can lead to confusion and anxiety. Dementia can also affect a person's ability to perceive sound. Some individuals may become more sensitive to noise, finding everyday sounds like the hum of a refrigerator or the ticking of a clock to be overwhelming. Others may experience a reduced ability to hear, leading to difficulty understanding conversations or distinguishing between sounds. Changes in taste and smell are also common in dementia. Individuals may lose interest in food or become overly picky about what they eat, which can lead to nutritional deficiencies. They might no longer be able to enjoy their favorite foods because of changes in their sense of taste. Or they may find that certain smells, once familiar and comforting, now seem unpleasant. Sleep disturbances are another common symptom associated with dementia that can significantly impact an individual's daily life. Changes in sleep patterns can occur early in the disease and may present in various ways. Some individuals with dementia may experience excessive sleepiness during the day, often falling asleep during routine activities such as watching TV or having a conversation. They may have difficulty staying awake during the day and seem unusually tired or lethargic. On the other hand, some people with dementia may experience insomnia or have trouble falling asleep at night. They might wake up frequently during the night and have difficulty getting back to sleep, leading to poor quality rest. As a result, they may become more irritable, fatigued, or confused the next day, which can worsen other symptoms of dementia. Another sleep-related issue that can occur in people with dementia is sleepwalking or nighttime wandering. Individuals may get up and wander around the house in the middle of the night, unaware of their surroundings or the risks involved. This wandering can be particularly dangerous, as it can lead to falls, injuries, or getting lost. In some cases, people with dementia may become disoriented at night and experience confusion, which can lead to unsafe behaviors such as leaving the house in the middle of the night. Nighttime agitation, also known as sundowning, is another phenomenon that occurs in some individuals with dementia. This term refers to a pattern of increased confusion, anxiety, and restlessness that typically worsens in the late afternoon or evening. People experiencing sundowning may become agitated, upset, or disoriented during these times, making it more difficult for caregivers to manage their behavior and ensure their safety. Recognizing the early signs of dementia is crucial for ensuring timely intervention and managing the condition effectively. While it's normal to experience some age-related changes in memory and cognition, Dementia presents with more severe and persistent symptoms that impact daily life. Early signs, such as memory loss, confusion, changes in language, impaired judgment, and mood changes, should never be ignored. If you or someone you know is experiencing any of these symptoms, it's important to seek medical advice. A healthcare professional can conduct assessments, provide a diagnosis, and recommend strategies for managing the disease. Early diagnosis allows individuals to access treatment, develop coping strategies, and make lifestyle adjustments that can improve their quality of life. Dementia is a challenging condition, both for the individual and their caregivers. However, with awareness, early detection, and appropriate support, individuals can lead fulfilling lives while managing the symptoms of dementia. By recognizing the early signs and seeking help when needed, we can ensure that those affected by dementia receive the care and support they deserve.